What's up, guys? So, really quick, I'm just going to talk about disc bulges or disc herniations, and if it's something that you need to be either concerned about or if it's something that's normal in our bodies. And the quick answer, you can talk about this for hours if you wanted to, but the quick answer would be if this is normal in most people's bodies. And that answer would be yes. Disc bulges, for the most part, are normal and usually nothing to be concerned about unless you're having other symptoms, which I'll talk about in a bit. And I'll take myself for example. If I went to go get an MRI on my back right now, and I looked at it, and most likely I would see that I have a disc bulge or a couple disc bulges for that matter. And I don't really have any back pain. I have it here and there, but nothing on a consistent basis. And so that kind of goes to show, and not just with me, but with lots of people, that images, while they're great with a lot of diagnosing a lot of things, um, it doesn't always tell the full picture. And that kind of goes to show for the disc bulges, just because the image is showing that I have a disc bulge or two disc bulges in my back, it doesn't mean it correlates with how I'm feeling and what my symptoms are. And so that's why you always need to kind of combine both looking at the image, but also how you're feeling and what other signs you're showing with that. So in terms of the disc, especially if you, as you're getting into your 50s, your 60s, a condition called osteoarthritis, which many people are probably aware of, just a degenerative change in your body, normal aging, totally normal, happens with everybody. But what happens pretty much is that these discs in the middle right here, they lose their height, so they get smaller and they shrink. And when they do that, the discs are more likely to bulge in the back. And these guys right here get more and more compressed. And so that can cause some back pain. That's why you're always thinking of people that are in their 60s or 70s, their low back hurts and they're having all this pain. And usually that's just due to degenerative changes. And there's ways to combat that, which I can talk about in another video. But that's usually the reason why. And then about the disc bulge, I'm going to add something real quick. So if you're feeling something down the leg, like a numbness or a tingling, that is due to, one sec. That disc, when it bulges, sometimes it can hit these nerves that are in between your vertebrae right here. And that can cause that numbness or tingling sometimes that people feel. And there's also conservative treatment for that you can see a physical therapist for. When you need to be a little more concerned or just go to your primary care physician and possibly get referred out somewhere is if you're having other symptoms like say if you have a fever that might not be going away, if you're losing a lot of weight when you're not trying to lose a lot of weight, or if you've been taking antibiotics or other medications for an infection, or if you've been diagnosed with an immunosuppressive disorder, things like that. When there's other serious things that you're feeling with your back pain, that's when you want to dig a little deeper and go to the right healthcare professional and make sure that they kind of diagnose you and guide you in the right direction. But in general, for this, for the sakes of this video, a disc bulge or a disc herniation in a normal, healthy individual, if you're not feeling any other serious symptoms, disc bulges are normal, and that they should not be something that freaks you out or that should put fear in your body. Because it's normal and it happens to everybody, and a lot of people don't think they just hear the word bulge or they hear the word herniation and it freaks people out. And for the most part, it's usually nothing too serious. And so, always see your healthcare provider. Always get checked out, and you should be on the right path from there. So, really quick, just wanted to talk about that. Hope that helped a little bit, and I will talk to you guys later.